Imagine your body has this incredibly sensitive master thermostat built right in. But, okay, instead of controlling the temperature in your living room, this thermostat regulates your body's response to stress, your metabolism, and your entire immune system. Now, what happens when that intricate internal thermostat just breaks? What if it gets stuck blasting at full heat? Welcome to This Explainer. Today, we're unraveling a real medical mystery. Cushing syndrome. It's this serious, absolutely fascinating endocrine disorder where prolonged exposure to the body's main stress hormone literally overloads the entire system. Let's get into it. Okay, let's dive into this. Here is our roadmap for today. First, we'll meet the stress hormone itself. 2, we'll see what happens when the system breaks. 3, spotting the warning signs. 4, how doctors actually diagnose Cushing syndrome. 5, treatments to restore that balance. And finally, 6, the long road to recovery. All right, section 1, meet the stress hormone, the vital role of cortisol. Now, you might be wondering, what exactly is cortisol? We hear about it all the time in popular culture, right? Usually as this quote-unquote bad stress chemical that we just need to get rid of entirely. But honestly, that couldn't be further from the truth. Produced by the adrenal cortex, cortisol is actually an absolutely vital, super helpful hormone. Without it, our bodies literally wouldn't know how to regulate metabolism, control blood sugar, maintain blood pressure, or even reduce inflammation. It's basically the chemical manager that keeps our body running smoothly and safely whenever we face a stressor. So how does this manager work? Well, this single hormone is part of a whole regulatory network called the hypothalamic pituitary adrenal or HPA axis. It's a mouthful, I know. Think of it like that household thermostat we just talked about. Step 1, the hypothalamus senses a need and releases a hormone called CRH. Step 2, that signals the pituitary gland to release ACTH. Step 3, ACTH tells the adrenal glands, hey, pump out some cortisol. And then step 4, this is the absolutely crucial part, negative feedback. Once cortisol levels are high enough, the brain actually senses it and dials back the CRH and ACTH. It essentially turns off the heat. It is just a perfectly balanced, beautiful loop.
Moving right along to section 2, when the system breaks, causes and classifications.
So our focus now shifts to what happens when this perfectly balanced loop malfunctions. The crucial point here is understanding the difference between two terms that get confused all the time. On the left, we've got Cushing syndrome. This is the big, broad umbrella term for literally any condition that causes excess cortisol in your body, and that includes external stuff like taking certain medications. Now, on the right, look at Cushing disease. This is a very specific internal classification where the excess cortisol is specifically caused by a benign tumor, an adenoma, sitting right on the pituitary gland, pumping out way too much ACTH. So remember, all Cushing disease is Cushing syndrome, but not all Cushing syndrome is Cushing disease. Make sense?
When we actually break down what causes the syndrome, we split it into 2 camps. Exogenous, meaning it's coming from outside the body, and endogenous, meaning it starts inside. And here's something that might surprise you. Exogenous medication-induced Cushing syndrome is actually the most common cause overall. This happens from the long-term use of corticosteroids like prednisone or dexamethasone. Now, on the endogenous side, the body itself might just produce too much cortisol because of adrenal tumors. Or it could be from something called ectopic ACTH syndrome. That's when tumors completely outside the pituitary, like certain lung neuroendocrine tumors, just start inappropriately making ACTH on their own.
Because medications are the leading cause here, we really need to pause on this. This is an incredibly high-stakes, life-saving role. If a patient develops Cushing syndrome from taking corticosteroids, those medications should never be stopped abruptly without medical supervision. No exceptions. See, because the external medication has been supplying synthetic cortisol, the body's natural production has basically gone to sleep. If you stop the med suddenly, you can plunge the patient into what's called an adrenal crisis. That is a severe medical emergency where the body suddenly has absolutely no cortisol at all. All right, section 3, spotting the warning signs, physical and internal manifestations. So how does an overloaded system actually manifest physically? These physical symptoms are incredibly visually specific, and they usually act as the very first surprising clues in this medical mystery. Patients will often see significant weight gain that's really concentrated around the abdomen, while at the same time, their arms and legs get remarkably thin because of muscle wasting. We also see very distinct fat redistribution. This can lead to a round face, often called a moon face, and a noticeable fat pad between the shoulders known as a buffalo hump. On top of that, the skin gets really thin and fragile, which means easy bruising and these wide, purple stretch marks, or striae, usually popping up on the abdomen. But you know those visible physical changes? That's really only half the story. The unseen internal damage is just as profound. Excess cortisol drives up blood pressure and blood sugar, which very often triggers diabetes. And the psychological toll? It is severe. We're talking intense anxiety, depression, irritability, and massive sleep disturbances. Plus, that muscle wasting we just mentioned, it leads to severe muscle weakness. It makes everyday things like literally just standing up from a chair or walking up a flight of stairs incredibly difficult for these patients.
Let's head into Section 4, Diagnosing Cushing Syndrome, Solving the Medical Mystery.
Okay, so how do doctors actually confirm their suspicions of an overloaded HPA axis? Well, clinicians have to build a definitive diagnosis through a very carefully structured timeline. They don't just jump straight to brain scans. First, they start with non-invasive screenings. Think a 24-hour urinary free cortisol test, or maybe checking salivary cortisol late at night, a time when those levels should naturally be low. If those come back elevated, they move to specific blood work to check serum cortisol and ACTH levels. That tells them if the issue is originating in the pituitary or the adrenals. Finally, if needed, they bring in the high-tech imaging, an MRI of the pituitary or a CT scan of the adrenals, to pinpoint the exact tumor. They might even use specialized, highly targeted procedures to track down ectopic ACTH production if it's hiding somewhere else. And this brilliantly illustrates the delicate balance of our endocrine system. Look at how Cushing syndrome compares to its exact opposite, Addison's disease. It's basically a giant seesaw, where Cushing is a state of severe excess, Addison's is a state of severe deficiency. With Cushing, cortisol is way too high, causing that weight gain and moon face. But with Addison's, cortisol is dangerously low, causing weight loss, sudden weakness, and intense fatigue. Understanding one perfectly cements your understanding of the other, right? It really just shows you how incredibly narrow the window for optimal health really is. This brings us to Section 5, Treatments to Restore Balance, Medical and Surgical Interventions. So, how do we fix the broken thermostat? The clinical solutions map directly back to the specific root cause we just talked about. If the syndrome is medication-induced, the treatment is a meticulously gradual steroid taper under strict guidance from a doctor. But if an endogenous tumor is the culprit, surgery to remove the pituitary, adrenal, or ectopic tumor is the primary defense. Now, if the tumors can't be completely removed for some reason, radiation therapy is used, and in the interim, or for very specialized cases, endocrinologists will rely on powerful cortisol-lowering medications like ketoconazole, meteropone, or osilodrostat, just to try and bring that system back down to baseline. And finally, Section 6, The Road to Recovery, Physiotherapy and Long-Term Care. Treating Cushing syndrome goes way, way beyond just surgery and popping pills. It requires immense, human-powered work for physical recovery. Because the muscles and bones have been so severely degraded by all that excess cortisol, physiotherapy is absolutely paramount. I mean, we're talking months of dedicated progressive resistance training, balance work, and functional mobility exercises just to restore strength and prevent falls. And this has to be paired with highly strategic nutrition. Lots of high protein, calcium-rich foods, and vitamin D to combat the onset of osteoporosis. Oh, and because recurrence is a real possibility with this, lifelong medical follow-up is an absolute must. So, what does this all mean for us? We've seen how the overproduction of just a single crucial hormone can ripple out and disrupt nearly every single system in the human body. It literally turns the very chemical meant to protect us against stress into a massive physical burden. Cushing syndrome is complex, it's serious, but it is treatable, and it reveals the stunning interconnectedness of our biology. It really leaves us with a compelling question to think about. If this single stress hormone exerts such powerful control over our daily health, from our bones all the way to our brains, how can we better respect and protect our own body's incredibly delicate internal balance? Thank you so much for joining this explainer. Keep learning, and as always, stay curious.